Hello, everybody. Welcome to Cny Fertility, Colorado's Tuesday afternoon jamboree, or In Search of the Stork, I like to call it, which is your chance to ask lots of questions, and hopefully I can give you some answers that make sense. Welcome. It takes a village. I like that. It's a Bren life. That's very nice. Sherry, nice to see you. Mika, nice to see you. Tanjerica, hello. Candelia Feliz Caro, nice to meet you. Stephanie, how about folks on Facebook Live? You guys are live there, so come on, make some noise. Hello, got some kisses, love to see it. Hello. We're the Baker clan. Okay, la la bee ba ba bee ba. Hi, that's great. Garvey Gardens, Miss Annie, Keo Maria San, nice to see you. Keo Maria San twice, nice to see you. BJ Pumping is there. Hello from Wisconsin. Miss Puffer, good to see you, my dear. Jasmine Batty, good to see you. Kelly Bridge, nice to see you. Hello from Pennsylvania. Felicidades. Alana, nice to see you. Paradise Island. Oh, that would be nice to go to Paradise Island. Hello, hi. Destiny's Kid joined us. Alana, thank you. Haley, hello from Florida. I wonder, a lot of you guys come to me from Florida. What's the deal? Okay, so I did promise that we'd finish up on endometriosis today. I apologize. We have been so busy that I have not gotten it to the level that I want. So I'll get to that last section of section 3. I still have section 1 and 2. Melissa Maloney, hello. Good afternoon. Jennifer Anderson, hello. Dariana Trinidad, Gote de Figuerera. Hi, doctor. I'm pregnant but scared because they found in the first a subchorionic hematoma. Well, all that is it's a break in the placenta. And the break in the placenta, it shows up on the ultrasound. Now, remember, it's probably, if this is your first ultrasound, it's about, oh my gosh, I can't even imagine. It's probably the tip of your fingernail in thickness. So the best thing is keep yourself hydrated. Acupuncture is wonderful for those. Make sure you're taking your medications. So those are the key. And rest and fluids. Sarasota is now open for business, not IVF. That will be sometime next year, but it's definitely open for business for ultrasounds and washes and a variety of other things. So you'll see announcements on that. Hello, Melissa. I said hi already. KTS. Kelly, can you do fresh transfer after doing testosterone and estrogen priming? Of course. But remember, you have to be at the right time of your cycle, and that is the progesterone determines the right time of the cycle. So when you get the endometrial receptivity assay, if you do that, you're basically trying to find out, is the timing correct based on the progesterone? Is Lovenox for retrieval only? Actually, Lovenox is not for retrieval at all. Lovenox is really more geared towards reducing the risk for a miscarriage in those patients with antiphospholipid antibody syndrome. Do you always have to start birth control prior to beginning an IVF cycle? Absolutely not. Are you the treating doctor at the Colorado Springs location? This is, yes, I am, one, and then Dr. Fink is another, and Dr. Banerjee is sometimes there. Even Dr. Kells sometimes comes. Hi, Hypno Fertility. Sophie, at baselines yesterday, my lining was 8. I start stims tomorrow. I was hoping to do a fresh transfer. What is the maximum thickness for a fresh transfer? There really isn't, Sophie. Macy, hello. All right. I was diagnosed with diminished ovarian reserve. Can that change over time, Tasha? Yes, it gets worse over time, unfortunately, because every month then you lose anywhere between 1,000 and 10,000 eggs every month. So getting care sooner is better. Johanna Laguna, should I still be okay if I run out of Neupogen by FET? Yes. Yes, you should. Tef VC joined. Hello. CD Chap joined. Hello. Dimps QB. Hello. Not many questions today on Instagram here, folks. Any questions on anybody's side here? Okay. Hallie, same. Okay. What type of sperm vials should be purchased for IVF? Actually, you can get unwashed, washed, ready for IVF, ready for IUI. The embryology andrology team can take care of it. Can you briefly talk about the traveling process? Yes. I'm coming in and out. I'm sorry to hear that. Thank you, Jasmine. I don't know what I can do here about that. I will do the best I can. So the travel process for us, we're one of the few IVF centers that really have no problems with working with other doctors. As a matter of fact, we want to work with your doctor to do your monitoring, as well as help them be able to treat low complexity infertility. I still keep going in and out. I don't know if there's anything I can do from my end. My Wi-Fi seems okay. I'm not sure what I can't move. I'm in a studio. Sorry, Jasmine. So what'll happen is the Global Travel Group will coordinate your care in your hometown, then if they can, and then you'll fly out to the place to get your eggs retrieved. And then once you're there, that's when the local team, whether it's the Colorado, the Buffalo team, etc. Okay, so lots of folks are saying it's not cutting out for them. I'm glad to hear that. Everything is good. Thank you. Thank you for telling me. I'm clear on Instagram. Check. What's the best prenatal brand? Honestly, there isn't a best. There are some that we carry, the Molecular Fertility. There's actually the Walgreens brand, which I reviewed, I think, during my supplements, which was excellent. So make sure it says, though, prenatal vitamins. It does. That's the way to do it. Arika, I have an AMH of 10, an A1C of 5, 108 pounds, and normal testosterone, diabetic, and I'm keto for 3 years. I heard AMH is related to PCOS. You don't want to lower your AMH. She's asking to lower it. No, AMH is simply a gas tank indicator for how many eggs you have. So it isn't the problem that PCOS has. It is not. PCOS patients tend to have a lot of active follicles. That's why the AMH is elevated, because that's what secretes the AMH. Is there a minimal amount of eggs you need to have before PGTA testing, Hallie? No, you could test one egg, and some people do. Hi, everybody on Instagram. Lots of people joining. Thank you, Super Freshy, Catherine, Panishi. Bird Bash is back. Hello. Can I pick the embryos I want transferred for frozen transfer? How do I let embryology know? I don't know what that means. What do you mean pick them? Go in the lab and pick them? I'm not sure what you're asking now. If you're talking about genetically tested, if you want a boy or a girl, sure. I'm not exactly sure, Jamie. Is there a minimum amount of eggs? No. I have been diagnosed with unexplained infertility. Is there anything I can do until I can get a consultation? Macy, absolutely. Download our family building guide. Start your acupuncture. Go to the American Board of Oriental Reproductive Medicine.com, ABORM.com. If you're in Colorado, go to eastwindsacupuncture.com. And start Serovital, which is a growth hormone secretagogue that you can get at Costco or online from Serovital, Serovital. Avoid alcohol, tobacco, street drugs. Husbands, avoid smoking at all costs. How often are egg donors updated? I have no idea, Maisha. Laura, can you stay on keto or the baby diet while pregnant? Don't have any data about that. I don't think it'd be risky because it's just basically a good fat food. Can you transfer 2 eggs if they are not tested? 2 embryos, Tanjarika. It depends on your age. The recommendation is 1, but certainly something to talk about. Do you recommend PGT testing for a young couple with only known fertility problem being male factor? We have no, so a young couple, you have to give me your age, Vic Gothard. Can you stay on, okay, we already said that. How much is gender selection? I think the additional cost for gender selection is $3,000 to $4,000. But that's also doing the genetic testing for normalcy and gender. Is it okay to continue serovital if pregnant? Yes. I heard you don't trang. What? So why not if tested? Okay, Antonita, so why not if tested? Why don't we transfer two chromosomally normal embryos? Because one chromosomally normal embryo can make 3 babies, and I've had it happen. 2 chromosomally normal embryos can make 8 babies. 8 babies. And I know everybody says, oh, that's fine, but it's not fine. You're 26. Yeah, PGTA testing has not been shown to help your group very much. That is true. We prefer not to transfer 2 chromosomally normal embryos because it's not necessarily better. Does diminished ovarian reserve, is that associated with reduced chances of successful IVF? Yes. FSH of 9, first IVF had 20 eggs. Wow. Would this lead you to believe I have PCOS? No, that's a very good number, Julia Duncan. Can you explain the ratio of FSH and LH? I was told the ratio is off and to delay my stim by 2 weeks and take estrogen and progesterone. I don't understand what that means. I don't understand the ratio of FSH to LH and why that would, I don't know who told you that. Okay. Can I get pregnant if my prolactin is high? Yes, but the big thing, Uli Shermanson, is the fact that it could increase your risk for miscarriages. That's the reason why we don't like to do that. Is it possible to conceive on only 4 to 5 periods a year? It's hard. It's not impossible. My doctor said he's satisfied with that, but I feel it's not enough. The periods are not it. It's the ovulation. If you're not ovulating, then your chances are 0. Can you get your AMH tested at your regular family doctors? Yes, absolutely. To finish the story, what you can do while you're waiting for our consult is download our family building guide, and there's a list of tests. And if you guys have all those tests, remember they are good for a year. So have them ready on your first visit. I think that to me, it saves you 6 weeks, maybe 12 weeks. Does genetic testing do harm to the embryos or sperm? I'm sorry, I'm not sure how they do it. Or is it harmless? Nothing is harmless in medicine. It has risks and benefits. The risks are very low. What is the drug to trigger or start a period? And that's some form of progesterone. You can use Provera. You can use progesterone in oil. You can use Crenone, progestins. Is the family guide on our website? Absolutely. Under the resource page, the family building guide is right there. I love you and I don't know you, Doc, because you are very positive. Well, I like to be loved. Loving me, that means a lot to me. Thank you. Because I am positive. I mean, there are only, if you believe in it or you don't believe in it, both are true. So why not believe in your success? Hey, doctor, I have a successful transfer in 2017 with my husband's sperm. No sperm in sample this year. High FSH and low testosterone. How likely are we to find sperm in a microtest? Actually, you should, Christina, ask the urologist, but I'd say it's not unreasonable that you would find some sperm, given the fact that he has, well, it depends on how high the FSH is and the reason. But the urologist should give you a real number. Thanks for the kisses. How long should you prime with Omnitrope? I'm 44 and this will be my first IVF. Well, K. Jefferson 01, I would say probably 3 weeks. I would say 3 weeks at a minimum. Is subchorionic hematoma common with IVF? Yes, Laura, all the time. How long does it take a karyotype to come back from testing? Probably a week to 10 days. My FSH is 4 and LH is 7. I was told to delay my stims by 2 weeks and take estrogen and progesterone. No, that doesn't make any sense to me, Carissa. Sorry, it just doesn't make any sense. And thank you, Ami, for putting the guide on the Facebook page size. Is IUI worth trying if my partner's count is 11 million and mobility is 10? Is it worth a try? Well, tell me how old you are, Candace. If you're over 30, not really. Going through reciprocal IVF, I will carry my wife's eggs. Besides prenatal vitamins and other substances, that should be taken by either of us. Okay, yeah, download our family building guide, as I mentioned before, on the resource page, and absolutely lots of good stuff. Start your acupuncture. If you're not local to Colorado, then consider the American Board of Oriental Reproductive Medicine. If you're local to the New York centers, consider the Healing Arts Centers. So you're 37, no. Candace, I would go straight to IVF. I did progesterone endometrium for a week to shrink assist, stopped medication yesterday, baseline labs today are 31, LH 21, estrogen. I was told to start stim. Is that appropriate? Yes, if your lining was thin. Thank you, Dims. How long does it typically take from the start of your cycle to an egg retrieval? About exactly 17 days. So if I delay my cycle by 2, isn't it correct that we should, okay, all right. Do you recommend taking Survival for doing IUI or just IVF? No, everyone, because it provides, especially as we age, more growth hormone. What are the benefits of Vital for pregnancy? None, zero. It has nothing to do with pregnancy. Can your ERA change from pregnancy to pregnancy? No. They've said that that's a timing of the way your body sort of responds. It's nice when you guys take a breather, because then I can take a breather. Okay, Dr. Mans, please, could a pituitary microadenoma prevent an embryo from sticking? No, because it's in your pituitary. Is oversecretion of prolactin a problem? Yes. Can IUI be successful with 1% normal morphology? It depends on how old you are, Jaylyn. It can be successful if I can answer it directly, but the probability is very low. Probability is very low. Okay, so Ada, just contact the CNY hotline or our regular phone number and call them and say that Dr. Magarelli said you'd like to speak with the Colorado team. At 45, how good are the quality of the eggs? Not very good, because a human's reproductive lifespan is about to 44, 45. So quality is just a function of age. So as we get older, the quality goes down. That does not mean you can't be successful. It just means I answered your question, but yes. Can IVF be successful if you have an ectopic pregnancy and have had 2 removed? And yes, because your ectopic pregnancies are not an issue in terms of IVF success. Maritza, using Zymot for fertilization processing sperm. I do not recommend it. Kimberly, I had a failed transfer in January of this year. Do you recommend ERA before my next transfer? Yes, especially, Kimberly, if they were chromosomally tested. Oh, April, third transfer is Thursday with Dr. Chang. Please give Dr. Chang my love there. What is the protocol recommended to help thin lining? Well, unfortunately, we don't have a specific one that we know works. So estrogen, progesterone, acupuncture, PRP washes are something that you can do. HCG washes, acupuncture. So Kim, they were, yes. So yes, do an ERA, Kim. Annie, Melissa Hebron, my first consult is November 2nd. Looking forward to it. Thank you for the encouragement. Oh, okay. Transfers that. Okay. What's ERA? It's not IRA, it's ERA, endometrial receptivity testing. So there's what one company calls it the ERA, another company calls it the ER peak. Both of them are just fine. Good. All right. Oh, and what are they? It's where you do a biopsy of the uterine lining at a specific time in the cycle when you would normally put an embryo in, but you do a biopsy of the lining, and then they'll time the date and time for how much progesterone you need to make a beautiful lining. Okay. Thank you. Thank you. Shaniqua, failed an IUI. Any IVF? I have PCOS. Yes. A family building guide, acupuncture, Zero Vital, low carb keto eating, avoid alcohol, tobacco, drugs, especially your partners. Should the husband take Zero Vital? Yes, because all of us, our growth hormones go down over time. I take Zero Vital every day. I don't own the company. I don't get anything from the company. It's the theory and the physiology seems to make sense to me to keep you vigorous and healthy. Would you recommend ATV 45 using your own eggs? I don't know what ATV 45 using your own eggs. Doc, would you recommend a 45-year-old, I think, use her own eggs? I don't recommend that. I do recommend donor, but certainly will help you. Absolutely help you. Had my retrieval today and wound up with OHSS. How long to anticipate pelvic pain? About 5 days with following instructions for physician. 200 grams of protein, absolutely. Pedialyte and 8 days of Dostanex, absolutely. Protein, and they didn't mention acupuncture. Acupuncture can reduce the long-term and short-term effects of OHSS. So definitely the ABORM, or if you're in Colorado, East Winds Acupuncture, Drs. Credenda and Dr. King. They're certainly friends of our practice, and they're excellent. 35 to 40, is that the average recommendation for using your own eggs pending your AMH is okay? No, I mean, we let everyone use their own eggs. I mean, we don't stop people. Okay. Can your family member who can successfully have children be a surrogate to avoid the high cost of of a gestational carrier? Absolutely, April. Gestational carrier, not a surrogate. I plan on doing my ER egg retrieval and all monitoring at Colorado. Yay. And the time I'm doing monitoring, do you think I can get the recommended amount of that? Yes. Julia, yes, start your acupuncture as soon as you hear this message. Second, contact eastwindsacupuncture.com and get your appointment set up because that's where you're going to go if you're in Colorado Springs. So you can do that. And the sooner you do that, the more likely you'll get the hours and the times you'd like. Okay. Do you recommend taking estradiol for someone who doesn't have regular periods? Sorry to ask so many questions. No. Everybody can ask questions. Well, you can't just take estrogen to start your period. You need estrogen plus progesterone. So that you do need to have both. And then if you're priming for IVF, the estrogen is going to help. Why acupuncture? Well, if you go to the website, eastwindsacupuncture.com, you'll see a dozen publications that Dr. Credenda and I have done. We helped create the American Board of Oriental Reproductive Medicine based on our last 20 years of research combining acupuncture with IVF. I would not do it until I did the studies, and the studies pretty much convinced me that acupuncture with IVF really increased outcomes and reduced miscarriages and improved live birth rates. So that's really where that all came from. I'm 28, had a laparoscopy in April to remove endo and scar tissue. What are some good things to add? I'm already on Lovenox, prednisone, and Prograf. Well, acupuncture, Zero Vital, growth hormone, avoid alcohol, tobacco, drugs, don't be around anyone who smokes. I'm 42 with regular periods, keto, carnivore for 5 years. I weigh 340 pounds. We are male factor. Do you think pregnant with IVF? Yes, of course. Just like smoking, just like there are many things that affect our health that can do that. It doesn't prevent you from getting pregnant, but there is an association. Now, an association is not causal. So you're doing the right things with the keto. You're doing the right things with the carnivore. It doesn't mean you can't get pregnant, but to answer your question directly, it can reduce your chances, but not zero. But remember, everybody has either a 0 or 100% chance of achieving a pregnancy. Nobody has a 30%. How early should you start acupuncture for fertility? 3 months before is great. When do you do the acupuncture to help IVF? 3 months before. I just answered that on 2 different platforms. Should you continue with acupuncture throughout your pregnancy? Yes. And I can't tell you the amount because that's your acupuncturist, but they have many treatments to reduce miscarriage rates. Are there areas to focus on with acupuncture? Well, sure. And if you go to an ABORM certified acupuncturist, that's ABORM.org, and say Dr. Magarelli told you to go there, since I've trained all 1,000 of them. Are there no known factors, only the ectopic, only 6 retrievals, any reason? Only 6 eggs retrieved, Antonetta. Well, what's your AMH, Antonetta? Is it possible to only get a positive home pregnancy test on day 9, 10 after a 5? Is it possible? Yeah, remember the home tests are not that accurate. We treat all patients. We don't label patients tall, short, green, yellow, skinny, or not. We don't have any labels. We treat all patients. We have specific areas based on BMI where we have a better facility for high BMI folks. But no, we treat all patients. MRTHAB 90, have endometriosis and doing 3 months of Lupron? Yay. Should I ask to add microdose Lupron, add Lovenox aspirin? Who are you asking? Yeah, I'm not sure who you're asking. 33, too fast. M42, my second IVF, I could produce 5 blastocysts. Wow. First transfer failed. Can my fibro all outside my uterus be preventing implantation? None were tested, but were high grade. Yeah, it's the age that's the issue. What facility is better for high BMI patients is the Syracuse facility because they do everything in the operating room. A lot of the other facilities do it, and that's only if your BMI is like 50 or 60 or 70. If it's in the 40s or below, certainly a procedure room can work. And again, we could pretty much do it everywhere, but I'm just giving you a hint. Why did you choose your profession and what's your favorite part about my career? This is April. Wow, that's about me and this is about you. That's too long a story. Too long a story, honestly. Should I? Not with 1,000 questions, but thank you for asking, April. Yeah, thank you, Julia, about this. That's on the Facebook, YouTube side. They gave a list of the how to find a practitioner on ABORM. Should you take iron as a supplement if you're anemic? Yes, or it's part of your prenatal. If a travel patient is not doing monitor with New York office, how often would you need to go to New York office until transfer? Well, if you're not doing your monitoring, then you only go there for the retrieval, 2 or 3 days, and the transfer 2 or 3 days. Ali Unnatural, I guess. I have a positive test and my HCG is 19 after transfer. What does that mean? You're pregnant. That's what it means. Congratulations. First field transfer with donor embryo. I'm 43. Good plan to try modified natural next time. Ms. Sutton, I don't have that in my educational medicine bag. That quotes natural has anything to do with getting pregnant. I don't. Yeah. So I understand some people think it's the cat's pajamas. I just don't have the data for that. What would you recommend for 3 implant failures? I was on Lovenox. Well, Shelley, I would find out if you had endometriosis. I would look at doing an ERA. I would look at doing acupuncture, avoiding alcohol, tobacco, drugs, doing Vital. They're really simple. What makes your IVF treatment more affordable than other specialists? It's a choice, DIMPS QB. It's simply a choice. What's an ERA? Endometrial receptivity assay. It's an assay that looks at the appropriate timing for implanting an embryo, and everybody can be slightly different. So this one finds out what those differences are and essentially fixes it. I'm doing an FET this month. Is it okay to get the flu shot before the FET, or should I wait to get the vaccine? Before the this month. Well, that's a hard question to answer because I do think the flu shot is important. Depends on how close you are to the transfer. I think it would be safe, but you might want to check with the office. Is it safe to do HSH and H a few days before starting my treatment? Well, you have to do it the month before, Estefani. What about the cure-all pineapple core after transfer? Does it really help? That is unfortunately a myth that's around the internet. Oh, Shelley, what's ERA? Oh, my regular GYN can do an ERA, yes. I'm doing an FET this month. Is it okay to get the flu shot? We kind of. Stella Licious is back. Hello, Stella Licious. Is the co-vaccine mandated at any of the facilities? Not the vaccine. Not yet. It may be. Do you think the HCG wash? Okay. What reason could be there for only 6 days retrieve on the first IVF? I'm 33 years old. And, besides the ectopic on the left and the block tube on the right, that could be the reason. Blood flow. That would be my guess as part of it, but also check your thyroid. Make sure you don't have Hashimoto's thyroiditis. Okay. Yeah, don't ever believe in cure-alls if you don't mind. When will you know if it will be the vaccine? No idea. What causes thyroid issues in pregnancy only? Well, I don't think it's pregnancy only. I think they're exacerbated because of the changes in your immune system with pregnancy. What's an HCG wash? Well, that's where we spray into the uterus before the transfer the pregnancy hormone with the idea that the receptors are upregulated, prepared for pregnancy. A couple of papers sort of sounded like it might be helpful. Oh, okay, good. So yeah, I mean, the pineapple core, bromelain, it's an enzyme. There are a lot of people who take enzymes for a variety of reasons. I'm not exactly sure why that was a hit. When I lived in California, there was a restaurant that served a salad somebody happened to go there, who was trying to go into labor. She went into labor after the salad. And then from then on, they had miles and miles and miles of people standing in line to eat the salad because they wanted to have their baby at a certain time. So anything like that, that's humorous is probably not true. Caramel, well, if you're not having cycles, it may be for a lot of reasons, but if it's because of age or low ovarian reserve, then you might do donor egg IVF. I tested positive for an ANA titer. What does this affect? Well, it may increase your chance of a miscarriage if you have antiphospholipid antibody syndrome. And so aspirin, Lovenox are some of the treatments. We have no idea when transfers will be done in Atlanta. How many days do we need to stay for a fresh transfer? Well, if you're a day 5, then it'll be 5 or 6 days. If you're a day 3, it'll be 3 or 4 days. What can I do or eat to get my fibroids under control? Well, either surgery is probably the main thing if they're in the way. If I have Hashimoto's and underactive thyroid, but my levels are maintained in the normal range, I still have a good odds of success. I think the answer to that is yes. Any recommendations to prepare for a frozen embryo transfer? Well, acupuncture, serovital, growth hormone, the low-carb keto diet, the supplements, It Takes an Egg is a good book to look at. At 24 with an AMH of 0.9, is egg quality an issue? Not so much. It's more egg numbers. When you have IVF done, what date do you use to determine your due date? Well, your pregnancy test is considered that you're 4 weeks pregnant. What is a recommended starting dose for CBD oil? Not a clue. How long is the wait to get a transfer done in Colorado Springs after your initial consult? Going to be coming from out of state trying to plan? Well, it's after the retrieval. If you're having a fresh fresh transfer, then you're going to get the transfer the same month. If you're having a frozen, it might be the next month. When do embryos usually reach a blastocyst? Well, by day 5, 6, or 7. Yeah. Can we retrieve eggs from both female partners and implant one embryo from each in one IVF? No. Natalie. Retrieval. Yeah, I know what you mean. I'm 42. I've been advised to prime with estrogen and progesterone and stimulate with 300. What is your opinion? I agree. Hello, Megaleg19. Hello, Monica Harper. Can we transfer more than one embryo's first cycle? No. It depends on how old you are. It depends on if they're tested. It depends on a lot of factors. But pretty much the answer is it's not recommended at all to transfer more than one. What am I drinking? Just basically SodaStream bubbly water. SodaStream bubbly water. It's very dry in Colorado. And I'm talking a lot. Elaine. Hello, Mrs. Miyagi. Mrs. Miyagi. How's that? Dream Chick Design. Inspired Jessica. Welcome, welcome. Cervical biopsy showed chronic inflammation. Could that have been the reason for failed implantation? Currently on 30 days of antibiotics. Is that a good plan? Yes, 30 days of antibiotics is a good plan. Well, yes, endometritis can be a problem. That's an inflammation infection in the uterine lining. It's usually you can't tell that you have it. So certainly can, so I think the treatment is good. Why would you only have gotten 3 fertilized embryos out of 7 retrieved? Because that's the right number. In other words, you don't get 100. That's 3 out of 7. That's almost 50%. That's a lot. That's good. Was prescribed birth control pills due to PCOS? Also have male factor. Does the length of time on birth control pills have a negative effect on time to conception? Nope. I'm positive for ANA antibodies. Should Lovenox aspirin be added to the antihistamine protocol? Yep. Can a block tube ever unblock on its own? Yep. What is the main reason embryos are frozen on day 3? You have very few embryos. If you have lots of embryos, then you freeze on day 5. So the day 3, day 5 is only so that you have an embryo to transfer in case if you didn't freeze on day 3, they didn't make it to day 5, which is a positive and negative. Is it better to freeze eggs or do IVF and save embryos at age 36? Do IVF and save embryos. Having an FET tomorrow, is bed rest really recommended for the next 3 days? Yeah, well, 2 days at least. I've been struggling with infertility for 15 years. You did my embryo transfer on September 13th. And we are pregnant, Amber. Congratulations, Amber Broham Hitchcock. Oh, yay. Yeah, I was so disappointed. I was told that you should be able to retrieve 10 to 15 million. No, don't be disappointed. Everybody, do me a favor. When you get an egg or an embryo or fertilized or not, be satisfied that it's you. Don't be comparing. Same thing with grading embryos. Everybody asks me about grading. It means nothing. So don't do the grades. Why would you want to feel badly about something? That's kind of crazy. Same thing, good or bad or ugly embryos. Who cares? An ugly embryo makes a baby as well as a pretty embryo. So don't get caught up in that. How can a block tube unblock? Well, it may not have been blocked in the first place, or it may have been blocked with mucus and the mucus just goes away. Ash Bubble joined. How big of a risk is it to do genetic testing on embryos? Very small risk, less than 5% is pretty much the number I've heard. I got 10 out of 11 eggs fertilized. Jiminy Cricket, 5 blastocysts. Wow, and you're 42. Do I think one of those 5 is normal? Yes, I do, JJ. I do. I have PCOS. What's my thought on a day 3 4-cell? Day 3 4-cell. That's can make a baby. Put it in. I have PCOS and 2 failed IUIs and 1 failed IVF. We did a frozen transfer. What can we do to improve our second transfer? Coming up, acupuncture, growth hormone, Serovital, low-carb eating, your nutritional supplements, no smoking anywhere around you. So do you recommend doing it knowing we have only 3 embryos? Well, Samantha, there's a reason you do it. It's not, I mean, you have to have a reason why you're doing PGTA, Samantha. So that's what you have to look at, whether it's 1 embryo, 2 embryos, or 3 embryos, or 10 embryos. It's you have to have a reason. Thanks for the kisses. Currently taking baby aspirin, having a frozen embryo transfer soon. Does that stop at first beta or continue to take it? Jackie. Well, Jackie, I recommend it to 20 weeks. What is the perfect percent chance of conceiving with PCOS? It has more to do with your age than PCOS, your AMH than PCOS, than sperm than PCOS, than your uterus configuration than PCOS. So don't get too hung up on PCOS. All righty, let's see what's happening here. Is it oh, we already said that one. Oh, yes. Is it possible to get pregnant with low ovarian reserve without donor eggs? Absolutely. Absolutely. Low ovarian reserve is just low ovarian reserve. It doesn't mean it's like having a quarter tank of gas. Yeah, it's a quarter of a tank of gas, but you can sure get to the movie with that. So that's all it means is you have lower amounts, not that you have no amounts. Can we do a traditional sauna while and during conception and pregnancy? Well, I don't know. I mean, I don't know. Yeah, I don't know if you could do a sauna. And I'm imagining there's cultures that do saunas all the time, but yeah, I don't have an answer for that. I mean, for the guys, hot tubs are to be avoided. And for the gals, you don't want to overheat, because then that robs blood from the pregnancy, but I don't think there's a study. Serovital, do you recommend taking this during pregnancy? I just think it's a part of your life's vitamins. Can you do IVF with elevated liver enzymes? Yes, you can. How long should it take? But you should have your approval from your internal medicine doctor. How long should it take to start my period after retrieval? If it takes longer than that, when should I ask to get induced? Well, it should be about 10 days to 15 days. Caramel Kiss 4, hello. Lip Gloss, hello. Cassie Marie 80, hello. Only he can judge me. Oh. Been trying to conceive for 3 years. I'm 43. My husband is 46. IVF. With yes, is what I would recommend. Arianis, I got 44 eggs retrieved, but only 4 were good, and 1 resulted in a failed frozen cycle. Is this common in a young? No, it's not common. Male factor, low counts, morphology, motility. Urologist prescribed Clomid for 4 months, no improvement. Any other recommendations? Gisela. Well, yes, he can get gonadotropins like Gonal F and HCG, and get so he needs to go to a reproductive urologist. Hello, Caramel Kiss. All righty, I think Elaine, you're answering someone else's questions. Oh, you probably can, but don't stay there very long. Oh yeah, I got it. Is it better to do a frozen transfer instead of a fresh? Depending on the person, Victoria Kalu. Can I ask why for same-sex couples you cannot use a known spermicide for donor if in the 50s despite age issue? I don't even understand the question. Oh, okay. Can I ask why for same-sex couples you cannot use a known sperm donor who's 50 years old? I don't know. I don't know who said that. I don't know what that means. Samantha, tomorrow will be, wait a second, Carol and Neil. Okay, what are normal fertilization rates? Okay, what causes low fertilization? Usually a sperm issue. So, Jana, normal fertilization rates, you want to get about 70% of the eggs fertilized. That would make you feel pretty good. Yeah. BMI of 50, age 41. Should I lose weight before starting IVF? Nope. Lip gloss and lunges? Nope. Tomorrow will be day 5 for our embryos. The wait is stressful, but is there anything I can do while waiting? Yes, acupuncture. Trina, if using frozen sperm, do you have to get sperm analysis before using it? We have some from another IVF clinic that we will be transferring to CNY. No, I don't think so. I don't think so, if I understand the question. I've been talking since 4 a.m. this morning, so forgive me. I'm losing my voice here. You're welcome. Husband has oligostenospermia, only 13 sperm, and only one was mobile. You kind of just answered the earlier, but what would you expect from a reproductive urologist is they would go to the testicles, grab some sperm, and use that. If using frozen sperm, do you have to get sperm analysis? No. It's been 7 months since my last laparoscopy to remove endometriosis. Do I need another one before starting stems? Not likely, Kelly. How long does it take to get karyotyping test results back? I think you asked that already. I think it's a week to 10 days. At what point do you recommend 2 embryos for frozen transfer? I don't. Is that a teaser? Yes, that's a teaser. What can I do to regulate my period and ovulation? Start on Clomid, especially if you want to get pregnant, of course. May I offer you a virtual cup of espresso? It's not that it's my voice is tired. Yeah, well, thank you, Elaine. I'll take that virtual cup of espresso. What were the additional supplements you said regarding male factor when Clomid didn't help? It's not a supplement, it's a medication. It's called the gonadotropin, Gonalef, Follistim, Menopur, and HCG or Pregnol, Avidril. These are medications that have to be prescribed. Doing IVF for gender selection, we currently have 3 daughters looking for a boy. Yes, the only way to find a boy is with PGT testing. That is correct. Cheers. Cheers, everybody. All righty. And a kiss. God, I can't. You guys are wonderful. Thank you. You guys are wonderful. Okay. Dr. Magarelli, CNY Fertility, Colorado. By the way, Colorado, we got lots of spaces open for IVF patients. If you guys want to do your retrievals there, you can go to any CNY facility. So we got lots of spaces. We've built out our laboratory, built out our embryologists. We could do transfers, retrievals. So we got lots of space. So if you want to come out and have your retrievals out here, please do. We'd love to have you. How will the CNY announce winners for the October grant? I actually don't know. I should know, but I don't. Does anybody know how they announce the winners? I have PCOS. Would you suggest taking myoinositol? Yes, absolutely. Hey, Quoram Hussein, new patient at Colorado. Thank you. Thank you for being here. What is the concept behind priming with estrogen and progesterone? It's to enrich blood flow to the ovaries, which allows penetration to the cortex of the ovaries, which is where the eggs reside and hang out. So hopefully by getting more capillaries to the cortex, they will improve your access to eggs. Any suggestions for men who don't produce a lot of semen, but sperm count came back good? Well, sometimes guaifenesin, which is a cough syrup kind of stuff, can help. Hydration. If your semen amount is low, hydration, and that's until your pee is clear. Christina, I am scheduled for January at CNY Colorado. I'm over 40. Is it possible to get it any earlier? You mean you're ready to go for your retrieval? I think it is. I mean, that means you have all your work done. Call the office and tell them you want to do it sooner. Carolyn, I have 4 failed IUIs and had immunology testing done. Lucas said that antibody detection has to reveal inadequate response. This is way too much stuff. That's just too much for me, Carolyn. Sorry. Do you recommend ovarian bloom? Sure. How do you know if you have PCOS? Well, it's a very long discussion, but it has to do with having no periods or few periods or irregular periods. It has to do with androgen excess, so hair on the face, acne. It has to do with reduced chance for getting pregnant. It has to do with sometimes central obesity. So there's a lot of things that's associated with. Can a negative serum PT at 14 be a false? I have no idea, Bina. Yeah. Darn it, my phone died after asking my question about what I could do while I wait for my period. Everything, Samantha. You can do, go to our family building guide. You could do acupuncture. You can all of your testing are listed there. What do you suggest for FET aftercare, particularly activity and exercise? This is Lindsay. Well, moderate walking, swimming is great. Don't overheat. Keep yourself hydrated. Yeah. Is PRP an option that has helped women with diminished ovarian reserve? According to a few papers, yes, Christina. Do you recommend ovarian bloom if you have PCOS? Yes. I think it's myo-inositol, if I'm not mistaken. What is the success rate for a day 3 embryo? 0 or 100%, Vernalyn. But if you ask me that's your success chances. Population is based on age, AMH, eggs, and history, so that I need more information. You're welcome. What is fasting okay when stimming for a retrieval or preparing for a transfer? Yes. There's no negative to fasting, but of course you want to keep your energy reserves reasonable because it's an energetic process. Do you recommend doing egg retrieval after being on Lupron for 3 months due to adenomyosis? Yes. We've already done retrieval and our embryos will be day 5 tomorrow. Now I'm guessing we're just waiting on a cycle to start, I believe, right? There's so much that happens if IVF. I don't know how you guys keep up. I don't know how I keep up either. The Own Life. The Rachel Dion Life. There it is. What protocol for a 38-year-old with a regular period and ovulation in 1 tube? Well, IVF. That's it. Should you stop taking Serovital and ovarian bloom after your retrieval? Nope. Nope. Those are all good for you and for your life, etc. All right, everybody's quieting down. It must be getting that time. Is it possible still to do IVF without doing the progesterone shot, but just doing it vaginally? Yes. Not the ideal way to do it. And Facebook side, how you guys doing there? Can it hurt to start all vitamins, A quality vitamins 6 months to a year out? No, it can't hurt. Can't hurt. Any 45-year-old egg IVF success stories from your clinic? I'm sure there are, but we can't tell you because that's HIPAA violation. Do you recommend PGT testing? No known factors besides the ectopic. If you're between 35 and 40, maybe I recommend it, but otherwise, unless there's a reason, don't do it. Is it okay to be on birth control before IVF? You don't have? Yes, of course, Trina. Yes. Three failed IUIs, unexplained infertility, 29 years old, IVF, good chances it will work. Excellent chances, Brittany. Trey Cox, how often should I do acupuncture before transfer? There's 9 treatments. Kelly, I'm priming with Lupron. I'm waiting for a period before starting. Do I continue with the Lupron? Priming with Lupron? No, that's not priming. Not sure what you're doing. Can we ask a non-IVF related question? Of course. I mean, if it has to do with fertility. Okay. Anybody asking any questions? I'm getting kisses. That's good. KFK J227 joined. Can hysteroscopy be done during a retrieval? Yes. What is the normal AMH level? Also, what is the purpose of naltrexone during the IVF process? Well, a normal AMH level depends on the age of the person because it's like a gas gauge, okay? Is it possible to do an FET cycle with no medications after the transfer? No. Not if you want to get pregnant, Hyla. 23 with one miscarriage, pregnant again this next month and had a chemical. What kind of test should I ask for? A recurrent pregnancy loss test. Is DHEA recommended if you have PCOS? There's controversy there. I don't think it matters. I think I might have a hormone imbalance. Okay, yeah, so yeah, that could be the reason for the miscarriages. That's true. Angel, Dana that just joined, Dari Tapri just joined. We have about a minute left. So these are from 4 p.m. to 5 p.m. Mountain Standard Time. I'm Dr. Magarelli. I run the Colorado program with Dr. Fink. We have Amy Jenkins, our nurse practitioner. We've got an amazing staff of embryologists. We have andrologists. We've got clinical nurses. We've got medical assistants. We've got just ultrasonographers. We've got an amazing program that you're all welcome to come to. Chai, see you in February. See you in February. And normal AMH for 30-year-old is around 3-ish. Okay. Yeah, it's about 3. I'm 37. What is a normal AMH for you? Probably 2-ish. And I'm not sure of the purpose of the naltrexone during IVF, except for to reduce inflammation. If my doctors won't test, should I seek treatment at a fertility center? Yes, M aesthetic. Can FSH be lowered to allow for your own eggs to be used? No. Is it normal to cramp before transferring? Not really. Check your hydration. Okay, folks, I think I'm quickly running out of time here. I just wanted to tell you that CNY Fertility Colorado is very happy to be a part of the big CNY family. We have plenty of room for you guys if you want to do IVF. We're open Monday through Saturday. And we have Dr. Fink, Dr. Magarelli. We have a great team of folks. They care every minute of the day, and they care for you. Our goal is one healthy baby at a time. So thank you, April. Thank you, Ariana Williams. Thank you, Winsome. My name is Dr. Paul Magarelli, M-A-G. It's right on the screen here if you can see. Well, you can't see it over there, so I should put my name over on Instagram too. So anyway, it's on the Facebook side of things. I'm at the CNY Colorado. Trey Cox, I wish I could have met you, but hopefully I won't have to. All right. I agree. You guys have a wonderful evening. Thanks for spending it with me. I'll go get some more to drink, and then we'll see you next week. Yeah, I think next week there's going to be 1 week where I will, the next week I'll have it, but the week after that I may not have it Facebook Live. Anyway, thanks everybody. You guys have a great day. And remember, think pregnant thoughts, okay? All right. Thank you.